Good morning or good afternoon. Sorry, I got confused because of the weather today. Uh, we're going to give it a few more minutes here. I know that there's still a number of folks getting on and joining us. For those of you who are on, thank you so much for coming and for participating in this. We do appreciate you having an interest in coming and joining us this afternoon. So again, we'll give it a few more minutes and then we'll get started. All right, good afternoon again, everybody. Thank you so much for joining us. So a few more of you have joined. We're still waiting on a few of the physicians to join us, but I just wanted to, again, say thank you very much for you guys hopping on with us to learn a little bit more about trauma and burn today. So we'll go ahead and start with the introduction of what we're doing here today, and I'll explain a little bit more. But again, this is an educational piece that we wanted to do here with University Health to really kind of expand the knowledge to the public, to those that are supporters of University Health, to be able to educate a little more on what we're doing here with University Health and our trauma and burn program. And so we have a few physicians and medical staff joining us here this afternoon that will be speaking to the various aspects of trauma and burn care here with University Health. And within University Health, we actually care for not only residents in San Antonio, but really a lot of many of the counties. I believe it's 28 counties within Texas. So a lot of the surrounding areas will be coming here if there was an incident and receiving care here with University Health. So our reach is pretty wide, and it's a pretty important part of South Texas here in receiving the care. So my name is Josh Rendon, and I'm a director here with University Health Foundation, and just wanted to again welcome you all. So today we have 4 physicians joining us. You probably saw in the invite that went out, and then 2 medical staff that are joining us as well. So we'll give them another minute to see if they will hop on. I see that Sandy is here, and thank you very much, Sandy, for joining us. Do appreciate your involvement coming on today. And for those of you participating and viewing this, Sandy is the Assistant Director of Pediatric Trauma and Burn and the Trauma Resuscitation Unit at University Health. And I'll go ahead and share a little bit about the other panelists that we have joining us today. So we have Dr. Liao, and she is the Pediatric Trauma and Burn Director at University Health. She's board certified in general surgery and surgical critical care. She's a past chair of the ABA, which is the American Burn Association Pediatric SIG, and she served from 2013 to 2018. We will have Dr. Stewart joining us, and he has served as the board chair of the Southwest Texas Region Advisory Council for Trauma since 1996. He's board certified as well in general surgery and surgical critical care, and he received the National Safety Council Surgeons Award for service to safety in 2013. We also have Dr. Crane, who will be joining us, and he is the Pediatric Burn Director and Director of Emergency Surgery, board certified in general surgery and surgical critical care as well. And he's the current board chair of the Pediatric SIG at the American Burn Association. We also have Dr. Eastridge, Division Chief of Trauma and Emergency Surgery at UT Health, retired colonel in the U.S. Army and awarded the American Association for the Surgery of Trauma Honorary Medal for Combat Surgical Care in 2004. And then Dina Perez-Graham, who's the Vice President and Associate Chief Nursing Officer over Emergency and Trauma Services at University Health. And then I already introduced Sandy. So let's see, we have joining us right now, we have Dr. Eastridge has joined us. So thank you very much, Dr. Eastridge. Do appreciate your involvement here today. And we're still waiting on a few of the other physicians to join us, and they will be here shortly, I have no doubt.
That she's having trouble getting on, so she's trying.
Oh, okay, perfect. And I will definitely keep an eye out and see if I can help her get on. Dr. Eastridge, since you're on, if you don't mind, if you want to go ahead and get started, if you want to start speaking about the trauma care that we're offering here at University Health. Looks like Dr. Eastridge, you dropped out there, so we'll give it another minute to get him on. Sorry for those of you participating. I apologize for the technical difficulties. Just bear with us here for a few minutes and we'll get that back going. But again, thank you guys for joining us and being patient with us. So thank you. Dr. Eastridge, looks like you, oh, and Dr. Liao, perfect. Looks like we got people signing on. Thank you guys for joining us.
Sorry, my connection just dropped.
Oh, no, it's okay. That's the world we live in. Technical difficulties are run amok, so we totally understand. Dr. Eastridge, if you don't mind getting us started, that would be fantastic if you could give us an overview of the trauma care that we offer here at University Health.
Yeah, so the team at University Hospital, again, we're one of the most busy clinical services in the hospital. You know, we have grown really iteratively over the last decade, really seeing substantial increases in patient volume from the community in the last 10 years. So currently we see about 7,000 to 8,000 trauma we do 7,000 to 8,000 trauma evaluations every year in our trauma resuscitation area. And that's really sort of all physical trauma. So from, we see, their patients are brought to us based on EMS criteria, as well as, patients just come into the emergency room. So we see really the full spectrum of injury care, from minor injury to the most severe injury. We see, like I said, we see about 7,000 to 8,000 trauma patients a year. We admit about 5,000 to 5,500 of those trauma patients a year because they're injured significantly enough to require admission and further therapy. In that number is our pediatric trauma population. We are the only level 1. I forgot to sort of tell the group that, you know, we're one of 2 level 1 adult trauma centers in San Antonio in the South Texas region. So we serve a 22 county area in South Texas, about 26,000 square miles, about 2.5 million people.
Did you have slides?
But I don't have slides, Dr. Liao. Are you talking to somebody else?
I'm talking to Dr. Crane.
So, you know, the valley, the border racks, including the border rack in Laredo, as well as the coastal bend rack, are relatively underserved. So we do a lot of injury care for those regions also. So again, we serve the vast majority of the landmass of South Texas for injury care. As I mentioned before, we are the only level 1 pediatric trauma center here in the community. Our pediatric trauma center, so we see pediatric trauma and burns. Our volume of pediatric trauma and burns every year is, and Dr. Liao and Dr. Crane will talk about that a little bit more here in a second. But again, that's so averages 1,200 patients a year, plus or minus. And again, we see the full spectrum of injury care for pediatrics. And then we see a moderate scope of burn care, again, covering, for all intents and purposes, all of South Texas. So again, we are a very busy clinical service. We have 13 faculty surgeons that staff the trauma team, as well as a dozen APPs, and again, a very active trauma services staff from the University Hospital. So we have a large team, but it takes a really large, you know, well-coordinated team to care for, you know, that number of patients over the course of, you know, the continuum. So with that, that's sort of a brief overview of trauma services and what we do in terms of trauma care for the community here in South Texas.
Thank you very much, Dr. Eastridge. I really appreciate that insight. I'm definitely learning things along with everyone else, so I appreciate that. And Dr. Liao, if I can turn some time over to you, and I'm going to stop sharing my screen. And so I know you mentioned that you might have a few slides, so if you want to share your screen and share those slides with us, and if you can't get it to work, definitely just, I can add them on my end. But I'm going to turn some time over to you, and I'll stop sharing my screen.
Okay, let me try to figure this out.
You can do it, Lily.
Maybe. Accessibility. Right. No.
And,
oh, here we go. No, it's allowing. Let's see.
and if you can't get it to work, you're always welcome. You can begin speaking and send them over to me, and I can always get them up on this end.
Sure. I think I might actually have to do that.
Sure.
In the interest of time. Let me do that real quick.
Again, thank you guys for bearing with us on this. We do appreciate patience and of course I do
your time.
We do appreciate everyone, all of our panelists here today. Again, they are very busy individuals, so the fact that they've taken the time to meet with us and share today is definitely greatly appreciated. So thank you all so much for joining us. And Dr. Liao, I have it. So if you want to start speaking, and I will get this up here in a second for you.
Sure, sounds good. I should have learned this platform a little bit better, but as Dr. Eastridge mentioned, we are the region's only level 1 pediatric trauma center. And embedded within this pediatric trauma center is our pediatric burn service. And really, I think, the idea of burn care is that we really need a whole big group of people together to be able to make a burn service happen. And I think Helen Keller has the best quote, which is, alone we can do so little, but together we can do so much. And it's putting together teams from not just University Hospital and UT Health San Antonio, but really the entire Southwest Texas region of hospitals and providers coming together to help injured children. And in this particular case, in our current focus on helping pediatric burn patients. Josh, actually, those are Dr. Crane's slides. If you could queue up my slides, they're in 2 separate emails, I think. He'll go through the details in a little bit for all of you. But I think what University Hospital has committed to over the last 10, actually going on almost 13 years, is really providing this comprehensive pediatric burn care for the children in South Texas. And comprehensive burn care really honestly starts on day 0 of the child's burn. And it takes not only dedicated surgeons, but it takes dedicated nursing, it takes dedicated physical and occupational therapists, intensive care providers. In this particular case, our pediatric partners at UT Health. It also takes our psychiatry team, actually, and our plastic surgeons, ultimately, to provide this broad care that a burn child needs, because burn care is not just the first 1 or 2 weeks of burn. Actually, once a burn has healed, that child may be living with the consequences of being burned for the rest of their lives. And whether that's psychosocial help or reconstructive help, that's something that over the course of the last 13 years, University Health System has really helped our program in building something that is a community that helps children with who have sustained burn really live their best life. And without this commitment of resources, we wouldn't be able to provide what we feel like as one of the best burn teams in the country. And because of that, we really feel like we should get ABA burn verification, because we're already doing so much. And not only are we providing this excellent care to the children of South Texas, but the people across the country are looking to us for our leadership. That leadership comes from Dr. Crane being the chair of the American Burn Association Pediatric Special Interest Group. And for an organization that is not currently ABA verified, that's a huge honor. And for us to have that kind of expertise in not just the surgical aspect, but really just creating this comprehensive team and having leaders in occupational therapy and physical therapy also join us. Our team has given multiple talks at the national level on how and what we should do for children who have sustained burns. And that speaks to the commitment of, not just resources, but of the people, and how dedicated we are to provide this burn care to really, truly make lives better in South Texas. So I'm really proud of that, and I'm really honored to be a part of this organization to be able to provide this burn care. And I hope you are too, because a lot of the things that you're doing really helps us make this possible. Next slide, Josh.
I think that was the last slide we had. Is there?
I think there's just one more that shows the kind of care that our team provides outside of surgical burn care. But I mean, it's not, don't worry about it. Yeah, that's it. And so really, you know, in terms of this advanced burn care that's offered, and these are some of the things that reconstruction, pain management, positioning, laser therapy to reduce scarring. These are burn care options that are not offered at any of the other facilities in town, which consequently means this really isn't offered at a program level in the region. We are the referral center for even Austin. Pediatric burns in Austin travel all the way down to San Antonio to receive the comprehensive care. And so I hope that you're proud of this program as much as I am. And I, of course, want to thank all of the leadership at the university health system level for making this possible for us, and for us to be able to actually brag about the program. It's because of the resources that you've poured into our program, and hope that you'll continue to support. So with that, I will turn this back over to Josh. Thank you.
Thank you so much, Dr. Liao. The insight that you provide is just...
Hey, Josh.
Yes.
I believe Dr. Stewart joined us. If you want to have Dr. Stewart make some sort of introductory comments also, since he's basically the, you know, substantively has really developed this program over the course of his career.
I think it'd be good. Me down to talk at last for just a few minutes, Brian.
But, okay, I don't see the itinerary. Okay, I'm sorry.
But I will. I'll just echo all the things that you and Dr. Liao have said. This is a great program, but thanks, Brian.
Thank you, and thank you, Dr. Stewart, for joining us. Really do appreciate you and Dr. Liao, all of the individuals on the panel today. Thank you guys so much. And with that, we'll move down to Dr. Crane and Sandy. If you guys want to talk a little bit about the patient journey, and then Dr. Crane, you can continue on about the outcomes and the ABA certification that Dr. Liao had mentioned. And I'll switch over to your slide deck here.
So this is Sandy Epley. I'm the Assistant Director of the PD Trauma Burn Program. I'm going to let Dr. Crane take this, but I want to echo Dr. Liao's comments about the team effort. This isn't just one or two people. It's a full spectrum of healthcare providers that are in a position to really improve the quality of these patients' lives. And I think that that is one of the driving forces behind the program's success, is that everybody's focused on that, being able to be with this team that is able to make that big impact.
Perfect. Thank you, Sandy. Thank you, everybody who are on this call right now. Hi there. My name's Dr. Crane. I'm the Director of Pediatric Burns here at University Hospital. And so one of the things I really wanted to kind of put out there is to kind of emphasize who we are as a burn center, as a trauma center. We are one of the only two, like Dr. Eastridge and Dr. Liao has said, major level 1 trauma centers here in San Antonio, and we take care of both pediatrics and adults alike. We have over 8,000 trauma patients per year, and we're really the only pediatric burn center in San Antonio, and one of only a few in all of South Texas, the whole South Texas area. What this translates into, like as Dr. Liao alluded to, is that we have a large area that we serve, the population that we take care of, that we see every day, every year. And so that translates to about 300 to 350 new burn patients every year. Breaking that down, it's at least once, about one a day. And that translates also to a clinic volume that's robust, and that we follow these patients for a long period of time in order to ensure that they have adequate treatment options, reconstruction options, and this allows for good patient outcomes. And we've been really proud of what we've been able to provide for the group that we serve. Next slide, please. So as we've all alluded to in different aspects of the burn care, there are three major, areas that we look at for the management. First is the initial burn wounds themselves. Now, this is a bunch of, critical care physicians, trauma surgeons, and even anesthesiologists who are helping with the critical care, the resuscitation. This, can lead to lots of dressing changes, skin grafting, needing a robust nutritional support to heal, physical and occupational therapy to allow them to get back to their normal lives, to allow them to, transition to be able to use their joints and use their muscles like normal. And then a lot of the psychology and management of the PTSD that goes along with it. It's a management of the patient, but also the patient's family, as this, this is a major traumatic event for a lot of these kids, and it can be for siblings, for parents, as you can imagine. We manage inhalation injuries, as maybe the child is not burned, but they were unfortunate to sustain a bunch of inhalation of smoke. We manage those just alike. And then again, we see chronic management of these burn wounds with scar reconstruction, splinting, and other things that help to allow these patients to get back to their normal lives. Along with that, with the chronic wound management, we have burn camps that we attend and we set up to help patients who have been burned or who have sustained injuries to kind of see that they're not alone, to see that other people are like them, that this is something that has happened to other people before. So the goals of our facility really are to entirely manage that patient, to manage the patient and their family. We hope to improve and continue to have a collaboration with BAMC, which is the Adult Burn Center here in town. And then we are aiming to become American Burn Association certified as a burn center. And as we kind of alluded to, the standards set for that involve burn surgeons, plastic surgeons, pediatric intensivists, pediatric anesthesiologists, but also goes into nursing staff, nutritionists, respiratory therapists, child psychologists, physical and occupational therapists. I mean, there's a large team that this encompasses, and that we all have to work together in the management of these patients in the acute phase, in the initial phase, and also in the long term for their overall management. So what does American Burn Association certification entail? There's a lot of things that go into the actual certification, but getting training for all those groups and subsets of people that are involved is one of the foremost things that we can do and provide. We do collect and monitor data to ensure that we are providing the best care that we can for these pediatric patients. Keeping up with standards, collecting data, ensure that we're one of the best in the country at what we do. And also keeping up to date facilities, equipment, and to ensure that we are, state of the art and doing our best to take care of these patients and their families. So this slide's a little bit wordy, so I apologize, but the basics of this is why do we want to become the best, or why do we want to become American Burn Association to have that behind our name, is because we've known for several years now that taking data from other fields such as orthopedics, cardiothoracic surgery, transplant, they have subset specialties for these complex patients. Through articles that have been published for over 7 years now, we know that pediatric specific hospitals that deal with pediatric burns entirely keep up with the special needs and consideration of those of patients that are developing not only physically but psychologically and psychosocially. Adult focused centers can do the same thing, but they often don't account for a lot of the stuff that the pediatric patient population needs as well. And the last slide is almost the same. It's just kind of another kind of look at some of the data that looks at the overall burn percentage, and basically what this article summed up to say is that a robust pediatric burn center shows a better decreased death rate, increased results, good patient care, which leads to overall patient satisfaction and overall patient care. And then I think that's the end of my slides, but I do want to thank everybody again one more time for being on this call and all the help that you can provide. Thank you, Dr. Stewart and Dr. Eastridge, as well as Dr. Liao, for allowing me to be in the situation that I'm in and allowed to, help take care of these patients as well.
Thank you very much, Dr. Crane. Really do appreciate you being involved in all of, again, to reiterate, thank you to everyone on the panel today. And we have one more speaker, Dr. Stewart, and following Dr. Stewart, if we have some time, we have a brief question and answer period, so everyone has agreed to stay on, answer a few questions. If we don't get to your question, if you do have one, you can certainly reach out to me afterwards, and I can help get the answer to that. So, but hopefully we'll have some time. So again, moving to Dr. Stewart. Thank you very much, Dr. Stewart, for joining us today. He's going to speak a bit about the future of trauma and burn care here with University Health and within San Antonio. Dr. Stewart.
Josh. So first, I'll just echo the gratitude for the foundation, for UH, for the support over the years. And to echo Dr. Crane, Dr. Liao, and Dr. Eastridge with respect to the importance and need for the pediatric burn program. And I'm going to say I sort of came to this, it's probably I don't know how long, Dr. Eastridge or Dr. Liao, maybe 15 years ago, where, I was not enthusiastic about us doing PD burns. We had never done it in any large number. We did it in smaller numbers, 20 or 30 years ago. But having said that, it's a really important program, and it's a common problem. Most of the common burns are relatively straightforward and minor, although they have risk of scarring. And there's just not a lot of expertise, though, with respect to the care of those children in the community and in the region. So it's a critically important program for our children. And really, all of our children, any of our children, could be significantly burned. We see kids from all across the region, from all different communities, all different socioeconomic strata, and so it's a really important program. And I'm really grateful for the entire PD burn team. The doctors Crane, Liao, and Sandy, her team, and all of the health professionals that Dr. Liao mentioned, which one, and I mentioned this, I think, at the meeting the other day, is that, one of the things that is particularly gratifying about our pediatric burn program is the care of the whole child, the entire child, from psychosocial needs to wound care needs to pain control. So it's an amazing group of people. So That's just echoing what you've already heard. What's the future of pediatric and burn in South Texas? I'm someone who's skeptical about predicting the future, and the pandemic, I think, should give us all pause to predicting the future. But I think we can speak for things that are virtually certain. One, we're in, and I'm not seeing post-pandemic data, but we're the fastest growing, or certainly one of the fastest growing big cities in the United States, and that's going to continue. So, there was a time.
I'm sorry, and we have two of the two fastest growing medium-sized metropolitan areas outside in New Braunfels and Bernie in the country also.
Yeah, and so we're in a very rapidly growing community. It's one of the reasons why UH and most other health systems struggle to keep up with capacity all the time, because we are in a rapidly growing city and region that is vibrant, dynamic, and it's going to get bigger. This is a good problem to have, but it implies what we must do into the future. We must provide these services, and we must provide them well, and we must provide them at a level that we would want our families to be cared for. So to me, the future is that the need for pediatric burn and trauma care will continue to be vital for the community. I think the other thing into the future, though, is there's highly probable competition, which there was not really competition in these markets for decades, but there's definitely going to be competition for other health systems in this marketplace, and so we just have to be prepared for that, and UH needs to be prepared for it. The other thing I would say is that we're fortunate to have a wonderful team of people, from physician to nursing to tech, across the entire spectrum, and our people are our greatest asset. Our people for these programs are our greatest asset. And so the past 2 years have been very stressful for those teams. They've been stressful on people across the world, but I think we should expect in the future, that we're going to be busy, and we're going to face a lot of stress in our healthcare professionals who are doing that, the people who do this work. So to me, the best thing we can do to help them is to provide the resources for the care, and help them provide the care in the most empathetic and compassionate way to our patients, because that really directly benefits the health and wellness of the people who are providing the care as well. So I think the future for UH is that we must provide these services, and we must provide them with the goal of excellence, like the care that we would want to receive, and the care that we would want our neighbors and friends and family to receive. So in some ways, we have decisions to make. Are we going to do this like has been said, or are we just not going to do it? Because it is possible not to do the PD burn program. I think it would be a great loss to the community, and somebody else would likely pick it up. But the future, I believe, demands that we all, from our physician team and from the healthcare professional teams at University Health, to grow and increase the sophistication of the PD burn program. And I'm going to say, I just look at it as a very low bar, simple step. We must get ABA verified. We have to do that. And if we're going to continue to do it, we have to do it. If we don't, I can tell you somebody else will become ABA verified before us. So that's what I think is the future.
Thank you very much, Dr. Stewart. As folks maybe thinking about questions that they want to ask, I do want to pose a couple questions here. Dr. Stewart, you had mentioned, kind of alluded to burnout amongst the care team. Is that, I mean, do we foresee that continuing and really being an issue? I know COVID presented a lot of that and has kind of been a major source of burnout physicians and staff working around the clock. Can we expect improvement in that, do you think? Or are we going to kind of continue to see this moving forward as a regular part of life for physicians and staff?
It's hard to predict. I would anticipate that it will continue to be a problem. It's definitely will be a problem if we don't work to manage it well. But it is the pandemic, but it's not just the pandemic, and it's things related to the pandemic. So the pandemic, I think everybody's aware of the stress of that related to healthcare professionals. As you know, people who know me well know, I see I see the horrible pain and suffering of the pandemic for our patients and for our healthcare professionals. But I think the pandemic has shown the very best of the profession, the very best of people willing to provide care 24 hours a day, to put themselves at risk for harm and death. And we see the amazing, beautiful results in our patients who've done so well and who come back and meet with us and talk to us. So I see the beauty, but it's not just the pandemic. It's the things related to the pandemic. Interpersonal violence, from all forms of violence, but firearm-related injury, assault, and self-harm are up significantly. And so, there's that challenge. There's the challenge that from our team members' point of view, from the teams we're talking about, there's a really large burden of untreated conditions and delay in treatment for surgical patients who basically have not gotten care for the past 2 years because they've either delayed their care, they've not had access to care. So treating our community members who have untreated, neglected conditions is also a great challenge. So in the short and medium term, I think we're going to see, we should all be aware that the factors that lead to stress and burnout in healthcare professionals is probably at a modern, I don't know for historical high, but probably a modern high related to all these events. So long-winded answer, but I would say we should expect that we need to be mindful and manage those teams. And to me, from the hospital point of view, the best thing the hospital and healthcare leadership can do is to provide the resources and the environment to care for patients, to meet the need that the patients were seeing, to have the resources to provide that care in a compassionate, caring, and empathetic way. That to me is the best thing that we can do to help ease the stress on healthcare professionals.
Hey, Dr. Stewart, can I tag on to what you were just speaking about?
Please do.
Yeah, so we have sort of looked at this, and it's sort of been looked at, across the nation. And one of the single biggest sort of issues with healthcare providers, again, it's not the number of hours. And many of us worked, many more hours during COVID. That is tolerable. The biggest thing that healthcare providers have, and I can say our group specifically also, is when we feel that we just don't have the resources to do the best for the patient. We run out of, and again, this is it was exemplified by COVID because of resource issues, manifest around the nation. But when we don't have the therapeutics, when we don't have the physical therapy, when we don't have the nurses, when we don't have all of the resources, and it takes a robust resourcing to staff and maintain a trauma center. When we don't have that and we don't feel we're doing 100% our best job for the patient, that is the single biggest, source of, healthcare angst and burnout these days. And I can tell you specifically that that exists with our providers.
Thank you, Dr. Eastridge, and thank you, Dr. Stewart. I really do appreciate that insight. And I think the point that you just made, Dr. Stewart, is great. The resources are vital. And I know that we've got a number of individuals joining us today that are supporters of University Health, and that's huge. Just the outpouring of support that we've seen within the foundation aspect, kind of lending themselves to support the health system through their time, their talent, their treasure, whatever it may be, is significant and certainly goes a long way in helping University Health continue in working towards the future of care with trauma and burn, along with all the different aspects within the continuum of care. So thank you very much for your guys' insights. I think we have another question here. So this is from Lou, and UH has been providing burn care already. What will the ABA certification help UH achieve? Additional federal funding sources, or be on approved healthcare provider list for insurance companies? Dr. Crane or any of the others, can you provide a little insight into that?
Yes, certainly. So having American Burn Association certification, it will ensure a lot of the things that we've kind of, discussed, having the resources, held to the high standards to provide the overall care that they're going to need on the entire continuum. We continue to provide education. We continue to provide positions that can be filled so that they can have total care for these patients, and to be held to the standards that we already hold ourselves to on a national level.
And I think exclusive of the ABA verification, our plan for the future, particularly as the Women's and Children's Hospital, comes to fruition in the next year or so, is, I think that, and Dr. Liao and Dr. Crane can comment on this, but we really want to iteratively grow our burn program. There is a population of burns that, again, that probably would require the resources, too extensive resources for us to manage at this point. And those children are sent down to Galveston, to Shriners. But again, as we can grow our program, get the additional resources, I think we've discussed internally that our plan would be to grow our program to be more self-sufficient for our community in the future. And Chris or Lily, if you want to tag on to that.
Yeah, and I think, Josh, it's a great question. If we're already doing it, we already have such a wonderful program. Why do we need ABA verification, and why do we need to do it now? And really, honestly, to be honest, with the group, we have competition. We have competition that is real, and across the street from University Hospital. A burn program has been stood up that claims to take care of burns of all ages. We're still receiving the regional referral, and we feel like University Hospital has the only comprehensive pediatric burn program in the region. and beyond our actual trauma region, extending to north of San Antonio and the Austin area. And in order for us to keep this market and our burn volume, providing the best burn care for all the children, we need to be ABA verified so that we can say that we're the only ABA verified center providing this quality of care that the parents demand, that really the people deserve in this region. And it's not that we're really going to do anything different as a burn program, but it provides University Hospital with the market share. And it provides the people in the burn program who's providing day-to-day care, the resources, the committed resources that's going to be there every year to take care of these burn patients to the best of our abilities and the resources that we have provided. So that's why we need it. We need to do this.
Thank you both for answering that. Well, there's one more tag-on question about how long is the ABA certification process?
So that's a kind of a complex answer. So it takes a long time to have established protocols, guidelines, a sufficient amount of resources and everything to be established for a good 6 months to a year before that you can even become certified. And then after that certification, it gets revisited every couple of years. And so your certification lasts for X amount of years, depending upon how well you do on your visit and how well your statistics keep up, how your outcomes are. If for instance you have a program that does become certified and then has issues with mortality or death or serious complications or whatever, then that would be a circumstance where they would have to say, well, we need to revisit the certification type thing. So basically it takes a year to get everything set up and established, and then after they come and look at your program, it takes another year or two before they revisit your center to ensure that you're still holding up the high quality that you agreed upon.
And so it's a process. It takes a while and it's ongoing after that time. To sort of piggyback on the reason why is these verification programs, the ABA verification programs is related to other American College of Surgeons verification programs, and which have uniformly showed improvements in quality and outcomes. So I know we sort of said, well, we're going to do the same thing. It doesn't really matter. Like we are going to do. Well, that's actually not true. I'd like to think that's true, but the bottom line is by the process, and it's a very simple process of set high but achievable standards. Those standards should ensure the right infrastructure, the right leadership, the right people, and the right equipment to do the work. So that's what those standards, you set those standards, they ensure those things. Then look at outcomes using risk-adjusted, risk-adjusted high-quality data. And then every 3 years, you have a verification visit from experts who come in and review your program. It does lead to improved performance. It leads to us doing better. It leads to hospital and health system administration doing better. And so it is an important quality issue. It is, and it is an important marker, which it's an important marker to show that we're committed to high quality burn care that may or may not distinguish us from our peers, but the main reason is for our patients. And I think it's a really good thing that the foundation is interested in ABA verification. I'll just say I think of ABA verification just like I think of trauma center verification as a part of core hospital operations. It really is should just be expected that we do those things. And so to me, when we do the event, I think it should be all about our patients and improving the care of their patients, and ABA verification is a part of that.
Thank you both for that insight. That's huge. And as a father to 3 young kids, it's kind of my worst nightmare to think about my child ending up in the hospital, or care of physicians for a burn or anything like that. But knowing that we're on that course and pursuing this and are already kind of leaps and bounds ahead of the 8 ball, that's great to know. And the pursuit of this ABA certification, it gives me comfort as a resident here within San Antonio, and knowing that my children would be in good hands coming here to University Health. So that's wonderful to hear, and I appreciate your guys' insight again on that. And I just want to thank you all for taking the time to speak with us today. We might have time for one more question. If anyone has any questions they wanted to send, if you have one and you weren't able to ask it, certainly you can send it to me individually, and I can seek out the answer following that.
We'd be happy to follow up with any questions the foundation folks have.
Perfect. And I appreciate that, Dr. Eastridge. That is very kind. I know you guys are certainly busy and doing the good work out there. So it has an impact. And I just want to close with, we're all part of this community, and hearing it echoed from the physicians and from Sandy today, just there's definitely that sense of community and that sense of, like, we want to be the best, not just to brag about it. We want to be the best because we want to be able to provide for those in the community that might not have anywhere else to go if University Health wasn't in this business, wasn't doing this work. So certainly have felt that from the folks on the panel today, and it's certainly reassuring to me. And I just also want to thank those of you who have signed on today to hear these wonderful speakers and hear what we're doing within the trauma and burn program to really advance care and what the future looks like. So thank you again for joining us. I know you guys could be doing any number of different things, but the fact that you have taken this time and are committed to learning more about what we're doing here is fantastic. And I have up on the screen there, I hope you can see it, but that's my contact information, my phone number there. For anybody that's viewing today, and again, maybe if you have questions after the fact that you'd like answered, give me a call. You can send me an email as well. We'll send out a follow-up email to everyone that has joined us today, and you're welcome to email me or give me a call and reach out. We would love to know your feedback on today, and if you guys have comments or questions, or you're interested in supporting us as we continue in this work with trauma and burn, certainly would love to talk with you about what that support looks like and continue forward. And so thank you all for joining us today, and certainly thank you very much, Dr. Crane, Dr. Liao, Dr. Eastridge, Dr. Stewart, and Sandy, for you guys' participation today. And I hope that everyone participating today appreciated today and appreciate what this medical team is doing and what University Health is doing, because it's certainly an impactful part of health and community here in San Antonio and beyond. So again, thank you very much for all of your participation today, and thank you all for being members of the panel today. We do appreciate it, and the foundation appreciates it, and on behalf of the community, we appreciate everything you guys do.
Thank you very much, Josh.
Yeah, on behalf of the whole trauma team, we really want to thank you for your engagement and your participation today.
Thank you, guys.
Thank you.
We did record this session today, so if you have someone that may be interested in viewing this later on, we'll be sending this out. So again, thank you all for joining us today. We appreciate it. And please reach out if you have any questions or if you want to learn more about what we're doing here within University Health. So thank you all so much.
Thanks.
Thanks,
Bye-bye.
Josh.
Take care, everyone.